Hi, my name is Aaron Baudet. I'm a licensed life accident and health insurance agent in the state of New York and many other states. Primarily, I'm going to be talking about New York here, but I wanted to give you some information on insulin drugs for 2021, as there have been some new regulations that may really help you if you're insulin dependent. So, certain companies have been allowed or have the option, all companies, to reduce the cost of insulin to $35 for a 30-day supply. This is pretty huge news, in my opinion, for a lot of insulin dependent people because the cost of it's pretty high. Now, not all drugs are going to go down to $35, and not all companies are going to offer that reduction. But a quick Google search, and I'm going to share my screen here. I'm using Zoom to make life a little easier. I'm going to share this. So here we have the Centers for Medicare and Medicaid Services, CMS, has announced it will allow Medicare drug plans to cover insulins with a $35 monthly copay throughout the planned year. Usually the coverage has different phases, usually a deductible, then you have your copays, which they didn't mention here, the donut hole, and then the catastrophic. But under the new option, Medicare enrollees with diabetes will pay $35 for each 30-day supply until they reach the catastrophic coverage phase, during which they'll only pay 5%. So insulin covered by a participating plan will not be subject to the deductible or donut hole phases. This is kind of interesting, participating. So you're going to have to do a little homework or have your agent, or you can call somebody like me to do that, because it's not as simple as it would seem. I typically like to use the Medicare.gov plan finder. Look, this stuff is overwhelming to a lot of people. I'm not going to get into the details here, but I want people to be aware that there may be a significant cost reduction for insulin, and not for everybody. I mean, if you have low income subsidy, this probably won't affect you. If you have extra help, which is the same thing, it probably won't affect you. But if you don't, or if you don't have full Medicaid, or you're not dual eligible, if you're just the average Joe, this could help you, especially if you're paying a lot for it. So I'm going to share the next screen here, which is going to come from Medicare.gov, because I want you to see some of the homework that I just did. I plugged in a couple of these drugs. I plugged in Humalog, which retails for $294 and change a month. Now, with this particular plan that I'm looking at, which I haven't disclosed yet, the cost after the deductible is $35. There's going to be no deductible for this. The cost in the gap is going to be $35. Now, this is usually subject to a deductible, whatever your deductible is on your drug plan, and then a copay. It's usually a tier 3 drug, which is, mostly a $47 copay. It could be higher or lower depending upon your plan. And after the gap, it's going to be $14.72 on a $300 drug. That's pretty significant in my book. I also noticed it with this insulin called Lispro, which I don't see that often. These are pens. This is, I think, a pack of 5 per month, $284, going to $35. All right, so if you look, I've looked up all the plans here. This is just picking up your drug at one particular place. This is a different place. I'm using an upstate New York type of zip code because that's where I live, outside of Woodstock. And this shows you your monthly cost, how much you're going to pay for drugs. This again is just making some assumptions. This one, Aspart, was not part of the program, so this is why the cost looks so high. But, and I know I'm moving fast here, if we go back, and now I've listed all the drug plans with those drugs in it by lowest drug and premium cost. So I can see the cost here with this plan is $6,000 a year. Clearly, that's a big number. But if we go down, they're going to jump up drastically. All right, so this plan is going to be $8,254. Let's see why. So if I go into the estimated drug costs, look at this. Humalog has a slightly higher retail cost, but the copays are much less before and after the deductible. They're higher in the gap. And after the gap, they're very low. However, this Lispro is not part of the program on this plan. So you got to look at the plans. The best way to do this is to put your particular drugs into this plan finder. So whereas that other plan would have cost you, was it 440 a month? This is, or 406 a month, I think. This was 660 a month. It's how critical it is to have the right program, the right drug plan. If you're in a Medicare Advantage plan, this is embedded into your plan. So you want to make sure you've done that. Somebody's done that homework for you. It's not that complicated, but nor is rotating my tires, but I don't really do it. I pay somebody else to do it. And just like you can do this, does an agent like me doesn't charge you to do these types of things. It's part of the service. And if we go further down this list, it's only going to get more and more expensive. For instance, if we went to, let's say, page 2 of these plans, and we went to this plan, we're into the $9,000 a year. So I'm going to go back and just take out this this drug right here that wasn't covered and doesn't look like it's part of the plan. You can choose your pharmacies, which I've done. I've just picked some of the most popular ones in this area. So let's go back in here, and I'm going to look at the drug costs for this particular plan. So we're seeing if you took Humalog or Lispro, your copays would be $35 a month. Whereas normally you'd be subject to a deductible, which could be $200, $300, $400, or I think the max is in the 400s this year. For next year, 2021, your copays would be $35. That's not too shabby in my book. If you belong assistance program here in New York, it's called Epic. Obviously, that could help you too. Again, depending upon income thresholds, your income threshold in New York. If it's under 75,000 and you're single, if it's under 100,000 and you're married, you can qualify for reduced costs of drugs. So again, I'm only talking about insulin here. What I would do if I was working with a client, all their drugs into this system. This is Medicare.gov. I would put all their drugs into the Medicare drug plan finder, whatever drugs they took. If they took metoprolol, lisinopril, atorvastatin, I put it into this program. I would, select the pharmacy that I like, and I'd compare it against other pharmacies. And then I would make sure I was clicked on 2021 up here for the plans for next year. I am looking at, these are prescription drug plans. There's 28 available here in this county. And treats my drugs most fairly. And that's where I would start my selection process. Maybe I wouldn't go with the first one. Get ratings and see, what I feel good about. I guess these all have 3.5 stars. Picking one of these right here. Now, where it really is interesting is if you're in a Medicare where your Part D drug plan is built into your hospital and medical plan. You're not on original Medicare or on a supplement. Then you would go to this button right here where I'm going to view the available Medicare Advantage plans. There's 33 available in this market for 2021, excuse me. So this is going to show me the lowest drug and premium cost, right? So this plan here is clearly saying, hey, it's $840 a year in copays. Those two drugs, considering those two drugs. It's all figured into this $840. Well, is this the right plan for you? I don't know. Do you want an HMO? Do your doctors take the plan? What's the cost sharing look like for other features? Doctors' visits, hospital stays, outpatient surgeries, X-rays, MRIs, CAT scans, diagnosis. Because add anything, this plan says it has vision and dental and hearing, telehealth. You want to make sure, first of all, your doctors are in. Because if your doctors aren't in and you want to keep your doctors, this is probably not the plan for you. I'm going to move on to the next one. Okay, the next one, the drugs cost a bit more, basically 20% more off the top of my head. But is this plan good for me? Do your doctors take it? This is how I operate. That's how good, what I think agents should do. Look at the drugs first. And we may eliminate half of the plans available. There's 33. We may eliminate most of them just by doing. Again, if you have Medicaid, LIS, extra help, or you're a low income earner and have Epic, these are less significant. So we're going to hunt for a company that covers your doctors. So I'm in plan number 5 or 6. I'm already at $1,768 year anticipated for those drugs. I mean, these are ballparks. So, there's going to be a serious argument there. Which plan should you strongly consider? You consider this plan, but it's going to cost you twice as much for drugs. So what do you do? What do you do if this plan offers you the least cost drugs, but your doctors aren't in the network? It's a tough situation. So anyway, I just wanted to make you aware of this quick video to say there's a new program that was signed into law by Trump in 2021. Not every company is going to participate in it. So if you're on insulin, I would suggest you do the homework. You have somebody do the homework. Just look into it, because there may be some savings of significance, available to you for this. So again, it's just an announcement. I'm happy to help if I can. And you can reach out to me, send me a message, call me, what have you. All right. Thanks so much. Bye now.